Welcome to the Maternity Mentor. Today we will be talking about what to expect during the first 24 hours after you deliver your baby and how being prepared can improve your recovery. Stay with us. Hi, I'm Samantha. I've been a registered nurse since 2009, working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC. I'm maternal newborn nursing certified, and I have received training in perinatal mood and anxiety disorders, as well as perinatal bereavement. The first 24 hours after you deliver your baby is a very busy time. There are lots of changes going on for both you and your baby. Let's explore what happens during the first 24 hours after you deliver a baby and how to prepare for it. Once you've arrived in your postpartum room, the first thing you might be thinking of is food. Delivery is taxing on your body, whether you've had a cesarean section or a vaginal delivery. Delivering a baby makes you hungry. While many women will eat a little something in the labor room, your postpartum room is where you can really enjoy a good meal. For mothers who've had a cesarean section, you may have to wait a little bit longer. Your healthcare provider or anesthesiologist may start you off slow, beginning with ice chips. This is because the anesthesia used for surgery can cause some nausea or even vomiting. As your nurse judges how you feel, she will slowly advance your diet, first to clear liquids and then to a regular diet. In addition to anesthesia, pain medication can also make you nauseous, no matter how you've delivered. Go slow when it comes to eating. In a few hours, these effects will go away. Then have your partner bring you your favorite meal. You deserve it. The first 24 hours after delivery is dominated by feeding your baby. It starts with helping your baby learn to eat. Whether breastfeeding or formula feeding, your baby has the instincts to eat, but not necessarily the skill. Babies may have latching difficulties for both the breast and the bottle. Babies can also be very sleepy after delivery. Your baby will need to eat every 2 to 3 hours. If you've delivered in a birthing center or hospital, the staff will help remind you to feed your baby and assist you with those feedings. Breastfeeding is highly encouraged due to its numerous health benefits for both mom and baby. For more information on the benefits of breastfeeding, please see our video on this topic. We will link that in the description below. However, one of the things that drives me crazy as a lactation consultant is how so many books and articles talk about the benefits, but fail to address how it will actually be. Breastfeeding shouldn't hurt, but it usually does for the first few days for most women. This is because breastfeeding is a skill that needs to be learned by both mom and baby. Yes, maybe your latch wasn't deep enough. Maybe your hold on your baby is a little awkward. Maybe the position isn't working. But remember, this doesn't mean you're doing anything wrong. Too often we tear women down in the hospital with everything that is going wrong with breastfeeding instead of everything that is going right. Realistically, breastfeeding may hurt for a little while. There are tips and tricks to help reduce this pain and make things more comfortable, but don't blame yourself. Remember, practice makes perfect. Formula feeding also needs practice. Plenty of babies have trouble latching in the beginning. Additionally, they may overeat, causing vomiting and gas. Finally, burping a baby is also a skill that needs to be learned by parents. Staff will also help you learn how to do this. For more information on the benefits of formula feeding, please see our video on this. We will link that in the description below. For moms who do choose to formula feed, your breast milk still may come in even though you don't stimulate your breasts. This can be very painful and can lead to mastitis. For more information on how to dry up your milk supply, please see our video on this. We will link that in the description below. After having a baby, one of the first things a mom thinks about is going to the bathroom. After a vaginal birth, your vagina may be swollen and painful. You may also have stitches from a vaginal tear or episiotomy. This can make you nervous to use the restroom. It's important to use the restroom every 3 hours to make sure your bladder is empty. When your bladder is full, it prevents the uterus from contracting back down properly, which can cause more bleeding and increased cramping. When using the bathroom to urinate, try squirting water on the perineum while peeing to reduce a burning sensation. Now, if you need to go poop, it's important that you do so when you have an urge. It's easier and less painful to go when ready than to strain because of constipation. Your doctor may prescribe a stool softener. I totally recommend you use this. Stool softeners are not laxatives. Instead, they draw water into the colon and the intestines, making your stool soft so that when you do need to go, it will be more comfortable. Additionally, if you have hemorrhoids, straining will make them worse, so stool softeners will also help this. For moms who've had a urinary catheter during a cesarean section, using the bathroom for the first time may be a little different. The catheter is often left in place for up to 18 hours after surgery. Once the catheter is removed, you usually have 6 hours to urinate for the first time. If you're unable to urinate, the catheter may have to be reinserted. So it's very important you drink plenty of fluids so that you'll be able to use the restroom and avoid this. Finally, your healthcare provider can provide topical medications that can help with pain and swelling. These medications are lifesavers. They can be used often and they're safe for breastfeeding, so use them. For more information on vaginal tears versus episiotomies, as well as hemorrhoids and how to treat them, please see our videos on these topics. We will link them in the description below. Before we continue, please remember to hit the like button and subscribe so you can get our latest content to have a happy and healthy family. Now let's talk about your baby's diaper changing and what to expect. Worrying about mom going to the bathroom is just the start. You will also be thinking a lot about your baby going to the bathroom. Newborns don't use the bathroom as much as you think, especially when you are breastfeeding. Yet parents often worry their baby isn't getting enough food based on the few diapers they see in the first few days of life. Babies need to have a minimum number of pees and poops per day in order to be considered healthy. On day 1 of life, they need 1 pee and 1 poop. On day 2, they need 2 pees and 2 poops. On day 3, they need 3 pees and 3 poops. This pattern continues all the way to day 8, where you see that they will need 8 pees and 8 poops per day, or basically your baby having a dirty diaper every time they eat. If your baby uses the bathroom more than these minimums, that's okay. But if your baby is not meeting the minimum, you need to speak with your pediatrician right away. They will check your baby to make sure that they are healthy. As your baby gets older, this pattern of output will change and will become less frequent. If you have any questions, make sure to speak with your pediatrician. After giving birth, you can feel like a bus has hit you. This is normal. Your insides have been rearranged, and no matter how you deliver, it is likely that you've been up for a long time with no food or rest. Taking it slow goes a long way. Focus on your recovery and enjoying your baby. Don't rush to try and do everything or be supermom. It takes 10 months to make a human being. You don't just go back to normal in 24 hours. You will be offered pain medication to help with the discomfort. All pain medications being offered, including narcotic pain medication, is safe for breastfeeding. Any medication should be taken as prescribed. Be sure to speak with your healthcare provider if you find that you're not getting good pain relief. Bleeding is normal after giving birth, but too much bleeding can have serious consequences. During the first 24 hours after delivery, your bleeding will probably be the heaviest you will have during your recovery. Helping your uterus contract back down to its normal size can help reduce your bleeding. There are 2 things that you can do to help with this. First, you can massage your uterus to make sure it's nice and firm. You press gently into your belly around the belly button until you feel the top of the uterus, which will feel like a ball. You can rub the top gently a few times and it will stay firm or get firm. This helps to prevent excessive bleeding, and this is called a fundal massage. Your healthcare provider can teach you how to do this. Second, you should urinate every 3 hours. I usually recommend that women pee before they feed their babies as a reminder so they don't forget to do it. When you're in the bathroom, check your pad and then change your pad. You should not be bleeding more than a heavy period. If you do, you should contact your healthcare provider immediately. Additionally, you may see a few clots, which are tiny balls of blood. This can be normal, but if you're passing clots bigger than a dime or you're passing a lot of clots, you need to contact your healthcare provider so they can evaluate you. Luckily, your bleeding will get lighter and lighter and should resolve in the next 6 weeks. Finally, sleep is a predominant concern for the first 24 hours. Labor takes a lot out of a new mother, and sleep can help restore that lost energy. It's important to rest a lot. Babies need to eat every 2 to 3 hours, which comes quicker than you realize. As they say, sleep when the baby sleeps. New babies also sleep lots during the first 24 hours of life. There are many changes taking place in your baby's body. Sleep is an important part of this process. Take advantage of the rest on the first day. Before you know it, your baby will be keeping you up a lot. Recovery from delivery is an essential part of getting you to your new normal. I hope this has explained what happens during the first 24 hours after delivery so you can feel prepared and confident during this critical phase of your recovery. Please share your comments and let us know what topics you would like to hear more about. If you like this content, please remember to hit that like button and subscribe so you can be the first to receive this information. Remember to share this channel with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.